welcome to my channel Weight Lecture. Today we will discuss multiple choice questions on veterinary surgery. Okay. Question number first. To maintain the oxygen carrying capacity of a blood, minimum packed cells volume should be options A 20%, options B 30%, option C 28%, or options D none of this. The right answer is options A, that is 20%. Okay. Uh, to maintain the oxygen carrying capacity of a blood, minimum packed cells volume in that blood should be that 20%. Okay. If we all know that in that among that all blood cells, RBC is actually responsible for carrying that oxygen. And if we talk about that the amount of RBC which is present in that packed cells volume, if that 1 unit of packed cells volume is approximately 350 ml, then RBC contain in it, that is 200 to 250 ml, while remaining volume is due to that plasma, WBC, platelet, anticoagulant, extra. Okay. And we all know that inside that RBC, that actually that hemoglobin is the one which is bind with that oxygen. Okay. That 1 gram of hemoglobin bind with 1.34 ml oxygen. Okay. But in some cases, like hemoglobin is normally bind is unable to bind with that red blood cells, like that when it's combined with that meth hemoglobin form, or when it's from that carbon monoxide form. Okay. Here's a normal hemoglobin level which is present in domestic animals, like that cattle contain 11.23 gram hemoglobin per 100 ml blood. Similarly, in case of buffalo is 12.9, and horse is 11.5, goat 10.9, sheep 14.4, pig 11, dog 13, and cat 12. Okay. Questions number 2. Dry heat sterilization is commonly used for which material that resist penetrations by steam? Options A fat, options B cloth, option C paper, options D none of this. The right answer is options A, that is fat. Okay. uh, Dry heat sterilization is commonly used for fat that actually resist penetrations by steams. Okay. If we talk about sterilization, sterilization is actually a process in order to that kill that all viable form of microorganisms from that the that contain. Okay. And there are different method of sterilization, like there is a physical method of sterilization, chemical methods, and filtrations, that mechanical methods. Okay. If we talk about a physical method of sterilization, it's mainly include like sunlight, and then drying, and there's a heat, which is two form, like moist is we used, and then sometimes we use dry heat. Okay. And last one is radiation. Okay. Sunlight is a natural sterilization method for disinfecting a tank and lakes, while drying is actually that used sterilizations to kill many bacteria, but spores remains unaffected from this drying. Okay. If we talk about heat, then we have dry heat, and we have a moist heat method. Okay. Under the dry heat, it also include four types, like we use that hot air oven, and we use like red hot sterilization process, and we use like flaming, or and we use like incineration method. Okay. Red hot air oven is actually that used for that sterilization of many like that utensils. Okay. And it's operated from 50 to 300 degrees Celsius. Okay. While red hot sterilization is the process in which that we that keep that element to that fire until it become that red hot conditions. Okay. And it is used for installation of bacterial loops, straight wires, tips of forceps, spatula, extra. Okay. While flaming is that also that burning that instrument to that fire, but it's not red hot conditions. Okay. It is used for like scalpels, mouth of test tubes, flax, glass slides, and cover slip. Okay. While incineration is completely one burn that material before it's discarded. Okay. And now similarly in moist heat, it also include three types, like we use that we that below 100 degrees Celsius. Okay. Which include like pasteurizations and insufficient in incision. Okay. Pasteurizations like for milk pasteurizations, insufficient like serum and egg media are used by these methods. at 100 degrees Celsius, which include like boiling, okay, for water, and tyndalizations, it also comes under 100 degrees Celsius, which include like which is used for distillation of sugar, gelatin, serum containing medias, okay. And how above 100 degrees Celsius, which is autoclaving. Autoclaving is like sterilize that substance in 121 degrees Celsius for 15 minutes and 15 atm pressure, okay. Autoclaving for like glassware, media, reagent, extra. And last one is that radiation. In that, under radiation we use two type of radiation, like non-ionizing radiations and that ionizing radiation. Non-ionizing radiations include infrared and like, which is mainly uh, infrared and UV ray, okay. Infrared is used for that rapid mass installation of pre-packed items like syringe, catheters, while UV ray used for enclosed areas such as like entryway, operation theaters and lab. And next one is ionizing radiation, which include like gamma rays and X-ray, which is used for installation of plastic, syringe, swab, animal feeds, oil, greases, fabrics and metal foils, extra, okay. In that by using that heat for distillation process, heat destroy a microorganism, like by destroying that the protein, by coagulating that protein of this microorganism, okay. Autoclave, which is used in that veterinary institutions, are actually gravity displacement autoclave, okay. Radiation, which is used for installation of surgical materials, is gamma ray, okay. A minimum relative humidity, which is essential for installation by ethylene dioxide, is 33%, okay. Questions number 3. The most common organism which is isolated from cat abscess are options A, pasteurized species, options B, Clostridium, option C, Salmonella, or options D, none of the above. The right answer is options A, that is Pasteurella species, okay. The most common organisms which is isolated from cat abscess is that pasteurized species, okay. Questions number 4. The example of clean contaminated operation is options A, enterotomy, options B, ovulohysterectomy, option C, anal surgery, or options D, none. The right answer is options A, that is enterotomy, okay. We already discussed about that the classification of a wound on the basis of like exposure, like clean wound and then contaminated wound and then infected wound. Under that clean wound we also get that two categories, like clean contaminated wound and then pure clean wound. And clean wound is like that sterile procedures in which we doesn't rupture or that open that into that entrance like GI tract, biliary tract, genitourinary tract or respiratory tract, while clean contaminated wound is operative wound in which we just that penetrate this area like biliary tract, gastrointestinal tract, genitourinary tract or respiratory tract, okay. But we doesn't spoilage their content, okay. And if we see that the major bacterial infection which is occur by that from that gastrointestinal tract, that is gram negative bacterial infection usually arises from this gastrointestinal tract, okay. Questions number 5. Afferent stimuli from the injury cause the release of options A, serotonin, options B, bradykinin, option C, epinephrine, or options D, all of above. The right answer is options C, that is epinephrine, okay. Afferent stimulus from the injury causes release of this neurotransmitters, that is epinephrine and glutamate, okay. Let's talk about the difference between afferents and efferents neurons, okay. Afferents neurons are actually those neurons which carries that sensory impulses from that the receptor side toward the CNS, while efferents neurons carry the messages from that CNS to that effector sites, okay. If we talk about afferent neuron, they consist very short axon, while in case of efferent neuron, we include very long axon, okay. Afferent neuron consists of a receptors, while efferent neuron, there's a no receptor, there's a lack of receptors, okay. Afferent neurons cell's body is situated in the dorsal root ganglion of the spinal cord, and if we see that there's no dendrites are found in it, while in case of efferent neuron cell body is situated in the ventral root of ganglion of the spinal cord, and it consists a lot of dendrites, okay. And afferent neuron consists only one a long dendron, while efferent neuron consists many short dendrite, okay. Afferent neuron is unipolar in nature, efferent neuron is multipolar in nature. Afferent neuron are found in skin, eye, ear, tongue and nose. Efferent neuron found in muscles and gland, okay. Questions number 6. Regeneration and hyperplasia are associated with options A, meiosis, Options B, mitosis. Option C, mutation. Options D, all. The right answer is options B, that is mitosis. Okay. Regeneration and hyperplasia. This process are actually associated with mitosis. Okay. Mitosis actually a cell division process in which that the daughter cells are formed, which contain exact number of that chromosome of these mother cells, and they are very identical to this mother cells. Examples of this mitosis, that all asexual divisions are comes under mitosis division. Okay. While meiosis is the process which is take place in that reproductive cells, in which that daughter cells are formed, but daughter cells contain half number of chromosome of that of mother cells, and they are not identical to that mother cells exactly. Okay. Example of this meiosis, that is all sexual divisions come under meiosis, like spermatogenesis and oogenesis. Okay. While a mutation is a process where there's a changing in the DNA. Okay, it is sporadic, it is not continuous or spontaneous process, it's sporadic process. And example of these mutations include like sickle cells anemia, cystic fibrosis, hemophilia, extra. Okay. Questions number 7. All are the principle of radiation safety except options A, lower the kilovoltage. Options B, increase the target to skin distance. Option C, use optimum filtration in the primary beam. Or options D, none. The right answer is options A, that is lower the kilovoltage. Okay. If we talk about radiation safety, it's mainly include three major principle. First, we should increases the exposure time. Okay. And if we should reduce the exposure time, like that we should decrease the exposure time first, in order to prevent the quantity of that radiation. Okay. Second, we can increase the distance the target to the skin. Okay. And third one is the shielding. We use that the something shield. Okay, filtrations in the primary beam. Okay. Questions number 8. A radiolucent foreign body which is lodged in that esophagus could be easily seen. Options A, on a dorsoventral projection. Options B, following a barium swallow. Option C, by making exposure during expiration. Or options D, none. The right answer is options B, that is following a barium swallow. Okay. A radio loosens a foreign body which is that lodge in that esophagus could be more easily seen if we given that barium swallow. Okay. This barium swallow should not be used in case of that when there is a rupture of the thoracic part of esophagus. Okay. Actually, the radiolucence, in case of radiolucence, the radiation doesn't pass, so it is very difficult to visible. But if we use that barium substance, it make them visible. Okay. If we talk about that X-ray, X-ray is nothing, is a form of electromagnetic radiations. It is also known as Roentgen radiation. Okay. If we talk about that X-ray wavelength, this is that very shorter as compared to the UV ray, but is longer as compared to the gamma ray. Okay, ranging from like 10 nanometer to 10 picometer. Okay. X-ray can penetrate most of that solid substance like construction material, living tissue. So it's used in a medical diagnostic process. Okay. If we talk about that X-ray that machine, that X-ray tube mainly include a falling part, like there's a filament and there's a focusing cup, there's a cathode, there's an anode, and there's a glass envelope, and there's a target and a tube housing. Okay. Uh, Here is a note that the temperature of the filament which is used in X-ray tube actually affect the quantity of the X-ray produced. Okay. And anode of the X-ray tube is actually the limiting factor in the maximum energy of X-ray that can be produced. Okay. Increase the atomic number. If we increase the atomic number of the target material, that also increasing the probability of electronic interactions. Okay. X-ray film that produce X-ray film which contain that X-ray images. Okay. It should be stored in a cool and dry places. Okay. Questions number 9. Cystography is indicated to diagnose. Options A, structural abnormalities of bladder. Options B, atony of the bladder. Option C, neither of this. Options D, none of above. The right answer is options A, that is structural abnormality of a bladder. Okay. Cystography is actually that imaging test that can help to diagnose a problem which is present in the bladder. Okay. And the cystography actually uses that X-ray. Okay. During this cystography process, the doctor insert that a thin tube that is known as catheter, urinary catheter, and also along with catheter also inject that contrast dye into that bladder to view the structure of that bladder abnormalities. Okay. Questions number 10. Which of the following statement is wrong? Options A. Intravenous pylography should not be indicated in severely dehydrated cases. Options B. Myelography is very useful in case of meningitis. Option C. Barium enema is useful to outline colon and rectum. Options D. None of the above. The right answer is options A. Options B. That is myelography is very useful in case of meningitis. Okay. Okay. So at first, that is a intravenous pylography. Pylography is that image testing that is used to look at the kidney and that ureter. Okay, in which that radiologist inject the contrast dye into one of the vein to view the abnormality of that kidney and that ureter. And it should not be indicated in case of that severely dehydrated patients, because severely dehydrated patients, if we use that contrast dye, it make more severe condition to that patients. Okay. Second is myelography is also that image testing that actually check the problem in that spinal canal. Okay. It is used to look for that conditions and diseases like herniated disc, spinal stenosis, infections like meningitis, arachnoiditis, etc. Okay. A contrast enema is an X-ray study that uses a water-soluble contrast agent that containing iodine or barium to show the structure of the large intestine, like rectum, colon. Contrast enema are commonly referred as a barium enema. Okay. Questions number 11. The function of a grid is to, options A, reduce developing time required. Options B, eliminate the need of collimator. Option C, absorb the secondary radiation. Or options D, none of the above. The right answer is options that is C, absorb the secondary radiation. Okay. Grid are actually a place between the patients and that the X-ray film. Okay, which is produced. Okay. In order to reduce that scattered radiations reaching the detector and thus enhance the quality and the contrast of this image, thus grids are used. Okay. Questions number 12. The objective of the developing solutions are to, options A, harden the emulsion and remove the unreduced silver halide crystal. Options B, soften the emulsion and reduce the exposed silver halide crystal. Option C, harden the emulsion and removes free silver. Options D, soften the emulsion and reduce free silver. The right answer is options B, that is it's soften the emulsions but reduces the exposed silver halide crystal. Okay. Okay, developing, we first know about the function of this developing solution. Okay. Developing solution is nothing, is its major function is to develop and to make the in clearly or that latent image make that more visible. Okay. So in that developing solution, a special type of chemical within a developing solution that act on this X-ray film, and it reduce the exposed silver bromide crystals to make a metallic silver form, so that image become more clear. Okay. Questions number 13. When a lead apron is worn for the radiation protection, the film wedge should be worn. Options A, outside the apron near the neck. Options B, outside the apron at waist level. Option C, behind the apron at waist level. Options D, behind the apron at chest level. The right answer is options A, that is outside the apron but at the neck level. Okay. When a lead apron is worn for the radiation protection, along with its apron, the film wedge also worn but outside the apron at the near to the neck regions. And the major function of this lead this that film wedge is to measure the total amount of the radiation, total amount of the body dose of the radiation which is received by the patients while working. Okay. Questions number 14. The clinical sign of fluid deficits appear after body weight loss exists about, options A 10%, options B 4%, option C 5%, or options D 6%. The right answer is options C, that is 5%. Okay. The clinical sign of the fluid deficits appear of the body weight loss that exists about 5% because of the dehydration. Okay, but mild clinical signs of fluid indicate that there's a loss of the body the fluid deficiency if the body weight taken that loss above about 6%. Okay, at 15% body weight reductions from dehydration, it's indicate there's a condition of there's a hyperosmolysis and there's a chances of circulatory collapse. Okay, if we see that the main cause of sometimes there's over hydration will be occurred. The main cause of this over hydration is that when there is a kidney shutdown condition like renal shutdown condition. Okay, extra if we talk about there's an extracellular intercellular fluid. Extracellular fluid is actually differ from that intracellular fluid is that it contain higher sodium. Okay, if we first know about that what is extracellular fluid and what is intracellular fluid. So intracellular fluid term itself implied the fluid which is present within a cells. Okay, the fluid which presents within a cells, while extracellular fluids include like that's blood fluid and also the fluid which is present between the cells like interstitial fluid. Okay, our albumin is mainly responsible for the osmotic pressure of the blood plasma. Albumin presence in a blood plasma. Okay, isotonic contraction in volume deficits of body electrolyte and fluid include isotonic dehydration and acute salt water deficits. Okay, let's talk about the different type of the symptoms and along that's related with that dehydration percentage. If the dehydration is that less than 5%, then the depression state is normal. Okay, sunken eyes, there's a no sunken eyes, and skin elasticity is less than 1 second, and no treatment is required. If the dehydration is that 6 to 8% is dehydration, then we can see in a cattle there is a slight depressions. And if we see that's a sunken eye, that's eyes will be shrunken that 2 to 4 mm. And if we see that's strict elasticity, then it's 1 to 2 second. And in such a case we have to given that the fluid therapy but by oral route. Okay, if there's a dehydration is 8 to 10% is there's a highly depression conditions. And if we see there's a sunken eyes, there's a 4 to 6 mm in sunken eyes, and skin elasticity is that 2 to 5 6, and in that case we need to give that IV fluids. Okay, and if the dehydration is 10 to 12%, then if we see that animal is unable to stand, and there is a sunken eyes is 6 to 8 mm, and skin elasticity is 5 to 10 sec, and in such condition we also give that IV fluids. Okay, in case if the dehydration percentage is greater than 12%, then animals is comes under that comas, they goes into the comas, and the sunken eyes that 8 to 12 mm, and skin elasticities that take that more than 10 sec, and in such condition we have to give them IV fluid. Okay, questions number 15. The specific function of carbonic anhydrase in the erythrocyte is to options A, enhance the chloride shift. Options B, enhance the carboamino hemoglobin carrying capacity. Option C, speed the breakdown of carbonic acid to carbon dioxide and water and vice versa. Or options D, speed oxygen release from the hemoglobin. The right answer is option C, that is a speed up the breakdown of this carbonic acid to carbon dioxide and water and vice versa. Okay, the specific function of this carbonic anhydrase enzyme in the erythrocyte is to speed up the breakdown of this carbonic acid to that carbon dioxide and water, and also form that carbonic acids from this carbon dioxide and water. Okay, this carbonic anhydrase, this enzyme is not only present in that RBC, it is also present in gastric mucosa, pancreatic cells, renal tubules, and it's catalyze the interconversion of this carbon dioxides and this carbonic acids. Okay, it also even function in the formation of acids by the stomach. Okay, note that carbonic acid and bicarbonate ion are present in almost equal concentration when the pH is that 6.1. Okay, questions are number 16. Which in blood least influence the heart action? Options A, calcium, potassium, sodium ion. Options B, oxygen. Option C, adrenaline. Options D, hemoglobin. The right answer is options D, that is hemoglobin. Okay, let's see the effect of ions on heart. Okay, uh, if we let's first see the effect of potassium on heart. Excess level of potassium cause the heart to become more flaccid and dilated, and there's a low slow rate of heart rate. And then excess of this potassium also cause that blockage conductions through that AV bundles, and also that contraction of the heart also become weak. Okay, while excess of that calcium lead to cause the heart to go spastic contractions, but it deficiency make that heart flaccid. Okay, sodium excess sodium cause that increases the blood volume, because as the sodium level increase in the blood, then as well as that blood water intake into that blood lead to that increase the blood volume, thus increase blood pressures, and also ensure rhythmicity. Okay, heart need oxygens to sustain myocardial contractions. Okay, if we talk about adrenaline increases heart rate. Okay, questions number 17. The change in electrolyte from long administrations of ACTH or cortisone lead to options A, metabolic acidosis, options B, metabolic alkalosis, option C, decreasing total body sodium, or option C, decreasing total body potassium. Okay, uh, the right answers will be like it's lead to cause metabolic alkalosis. Okay, if there's a long term administration of this cortisone, it's lead to increase that aldosterone level. Okay, and as well as that ADH level, and which lead to that increase sodium retention, and in that sodium retention, which lead to that excretion of this hydrogen ion. Okay, in place of sodium, and if there's a increase of this hydrogen ion, then biocarbonate level in that blood and that tissue will be increases as well. Okay, so that lead to increases of pH, and this lead to conditions like metabolic alkalosis. Okay, and sometimes that antidiuretic hormones augmented in body, it results from like that there's a severe pain and there's an injury. Okay, and that anti of this antidiuretic hormone, there's another hormone that is natriuretic hormones, which work opposite of this ADH and aldosterones. It's mainly stimulate the kidney to excrete out sodium. Okay, questions number 18. The blood for later transfusion should be stored at option C 10 degrees Celsius, options B 5 degrees Celsius, option C 4 degrees Celsius, or options D 0 degrees Celsius. The right answer is options C, that is 4 degrees Celsius. The blood which is stored for that later transfusion should be stored at 4 degrees Celsius. Okay, the maximum safe period to store blood with that the anticoagulant, that is acid citrate dextrose, is up to 20 days. Okay, the safe limit of collection of blood from a horse is that we can collect about 4 liter horses from that blood from that horse. Okay, the safe limit of collection of blood from a dog is 40 ml per kg body weight. The safe limit of collection of blood from cattle is 3 liter. The safe limit of collection of blood from goat is 315 ml. The safe limit of collection of blood from chicken is 15 ml. Okay, the maximum survival collections volume, that is we can collect that 10% of the total blood volume from that animal uh, as a safe limit. Okay, questions number 19. Sodium and chloride are present in body in the ratio of options A 1:2, options B 2:1, options C 2:3, or options D 3:2. The right answer is options D, that is 3:2. Okay, sodium and chloride are present in the body in the ratio of 3:2. That's 3 part is sodium and 2 part is chloride. Okay, in comparison to that extracellular space, concentration of magnesium in intracellular space is approximately 10 times greater. Okay, in comparison to blood, concentration of magnesium in milk is approximately 5 times greater. Okay, in comparison to normal plasma, the concentration of this bicarbonate is 7.5% solution of sodium bicarbonate is about 40 times greater. Okay, note, normal bicarbonate concentration in plasma is 24 to 28 MEQ per liter. Okay, questions number 20. The total body water in percentage of total body weight is approximately ranging between option C 40 to 45%, options B 55 to 65%, option C 60 to 80%, or options D 65 to 75%. The right answers will be options B, that is 55 to 65%. Okay, the total body water, if we're talking about in percentage of the total body weight, is that 55 to 65% of total body weight is actually water. Okay, if we inside that water, that extracellular water is that 15 to 20% of total body weight. Okay, we all know that total water means like there's extracellular water and there's intracellular water. Extracellular fluid mainly include that water which is present in a blood and that water which is present between the cells, that is interstitial fluid. Okay, okay. If we talk about that blood volume as a percentage of the total body weight in different animal, then a dog, that 8.5% of total body weight of a dog is that blood, and 5.7% of total body weight of cattle is that blood, 7% of total body weight of a goat is that blood, and 6.5% total body weight of the cat is that blood. Okay, percentage of water in a different body tissue in dog, then blood comprise that 76% of water, muscles also contain 76% of water, and 69% of skin is that water, fat include that only 10 to 30% that water. Okay, while sweating, actually we lost not only water, we also lost, there's a sodium potassium chloride. Okay, and sometimes there's an insensible loss, we cannot sense the loss of this water that occur through that lungs, skin, and stool, feces, extra. Nitrogens also leave from that body via lungs, skin, stool, feces. Okay, uh, that extracellular fluid can be measured as inulin space, while plasma volume can be measured as Ivan blue. Okay, questions number 21st. Which is not the source of metabolically generated hydrogen ion? Options A, oxidation of sulfur containing amino acid to organic acid. Options B, complete oxidation of fat and carbohydrate. Option C, incomplete oxidation of fat and carbohydrate. Options D, oxidation and hydrolysis of isoelectric phosphoprotein to phosphoric acid. The right answer is options B, that's a complete oxidations of fat and carbohydrate. Okay, that the only incomplete oxidation of this fat and carbohydrate produces hydrogen ion, and also that's removed electron, and also that sometimes that amino acids like methionine, cysteine, and cysteine, which is mainly contains sulfur, on oxidation they produce hydrogen ion. Similarly, oxidations and hydrolysis of this phosphoprotein, that's isoelectric phosphoprotein, to that phosphoric acid form also releases the hydrogen ion. Okay, questions are number 22. Biomaterial used in cardiovascular surgery have least affinity with. Option C, albumin. Options B, globulin. Option C, fibrinogen. Or options D, all of the above. The right answer is options A, that is albumin. Okay, biomaterial which is used in this cardiovascular surgery, it's found that has least affinity with albumin. Okay, that biomaterial we be used in that cardiovascular surgery should be that have durability, long term durable. Okay, should have strength and should have flexibility to withstand about that 2 million cardiac cycle expected to occur in an average lifetime. Okay, equally important, this biomaterial have that biologic property, like that it is anti thrombogenicity, non calcification, hemostasis, non immunogenicity, and endothelialization capability. Okay, questions are number 23. ECG of resting heart, option C, may predict myocardial infarction. Options B, may not predict myocardial infarction. Option C, both above. Options D, none. The right answer is options B, that is may not predict myocardial infarctions. Okay, resting heart conditions ECG sometimes does not show that myocardial infarctions. Okay, myocardial infarctions is commonly termed as like heart attack. Okay, heart attack occur when that coronary arteries of the heart get that impaired. Okay, sometimes that blood flow decreases, or some of coronary artery get stops because of thrombosis, that causing that infractions condition, that is tissue that to the heart muscles and lead to that heart attack. Okay, and the diagnosis of this heart attack is that we can do that blood test and we can do that ECG, and while we can see that ECG, we found there's a elevation of that ST elevations. Okay, that indicate there's a myocardial infractions. And if we do that blood test, we found there's a level of troponin and creatinine and kinase that in enzymes is increases. Okay, that also indicate there's a heart attack. Questions number 24, which is equal to the deviation of whole blood buffer base from normal value. Options is base axis, options B acid axis, option C neutral axis, or options D buffer axis. The right answer is options A, that is base axis. Okay, deviation of whole blood base from that normal value is termed as like base axis. Okay, Base X is actually that indication of the metabolic component of acid base status. That is a sometimes base excess in a positive, high positive base excess means there's a metabolic alkalosis, there's a high pH condition, and high negative base excess means there's a metabolic acidosis. Okay. Questions number 25. Which is false? Options A, use of AC does not affect fracture healing. Options B, use of acetylcholine does increase fracture healing. Options C, vitamin D promote calcium absorption. Options D, spiral fractures common in humerus. The right answer is options A, that is use of acetylcholine does increase fracture healing. Okay. That use of acetylcholine doesn't increase that fracture healing. Here the factor that's actually affect that fracture healing, like there's an age. In case of that younger animal, that fracture healing process is faster as compared to that older one. And also that locations, if that the fractures occurs in that the bone area where the we can maintain that immovable conditions that heal faster as compared to that movable places. Loss of tissue and bone, the increases the number of the increase the amount of the tissue and then bone losses, there is a more time will be taken for that fracture to be healed. And blood flow, that blood flow actually promote that healing process. Okay. Questions number 26. Inflammation of the ligament is known as options A, tendinitis, options B, cellulitis, option C, desmitis, options D, none. The right answer is option C, that is desmitis. Okay. Inflammation of ligament is desmitis. Inflammation of tendon is tendonitis. Inflammation of subcut tissue is actually cellulitis. Inflammation of lymph vessels, that's lymphangitis. Inflammation of lymph gland is lymphadenitis. Inflammation of gallbladder is cholecystitis. Inflammation of bile duct is cholangitis. Okay. Questions number 27. Which one observation is most useful for the assessment of close reduction of fracture of wing of ilium? Options A, urination and bowel movement. Options B, position of the limbs. Option C, all of the above. Option C, none. The right answer is option C, urinations and bowel movement. Okay. Fractures of the wing of ilium, that is a knocked down hip conditions, are relatively common in that adult dairy cow, and results we see that there's a results in ventral drop of tuber coccyx on the affected sites. And initially there is a pain too, but later on that pain will be decreased. Okay. And these fractures of iliums are actually repaired by two method, like that using the plate or that screw. Okay. And for that there's a fractures is healed, we have to see there's a urinations and bowel movement that become normal after that fractures get healed. Okay. Questions number 28. Cold applications are indicated in options A, subacute inflammations, options B, acute inflammation, option C, chronic inflammations, options D, septic inflammations. The right answer is options B, that is acute inflammations. Okay. Here's the table which show there's a how to treat acute and chronic inflammations. Okay. In case of acute inflammations, at first we have to remove the cause. We use that ice pack conditions, cold water irrigations condition. We use that estrogens lotions. We use also that anti-inflammatory injection. We use that antibiotic, and we provide that complete rest. While in case of chronic inflammations, we applied that warm applications and anodyne preparations. We also remove that inflamed part. Antiseptic solution we applied, massage we applied counter irritant to increase that blood supply, and also we try that Bayer hyperemic treatment. Okay. Questions number 29. A tumor made up of lymphatic or blood vessels is known as options A, angioma, options B, glioma, option C, myxoma, option C, neuroma. The right answer is option C, that is angioma. Okay. Tumor which is made of lymphatic vessels or blood vessel, that is known as angioma. Tumor of glial cells, that is known as glioma. Non-cancerous tumor of connective tissue, that is known as myxoma. Deorganized growth of nerve cells at the site of nerve injury, that is known as neuroma. Abnormal large amount of granulation tissue, that is known as proud flesh. A thickened and hardened part of the skin or soft tissue, especially in an area that has been subjected to friction, that is known as callus. Benign tumor formed from glandular structure in epithelial tissue, that is known as adenoma. Tumor in bone and soft connective tissue, that is known as sarcoma. Okay. Questions number 30. Traumatic reticuloperitonitis is more frequently encountered in options A, sheep, options B, goat, option C, buffalo, options D, none. The right answer is option C, that is buffalo. Okay. Traumatic reticuloperitonitis is more frequently encountered in buffalo. If we see the symptoms of TRP, that's recurrent tympani, abduction of the elbow. Okay, and for that TRP operations, we have to block that T13, L1 and L2 block. 20 to 30 centimeter long incisions, which is parallel to the last ribs, is given in case of TRP. and for that TRP operation we use that Wingard ruminectomy frame. Okay. Thank you class, this much for today. We will meet you soon in next lecture. Okay.